Welcome back to the Dr. Doug Show. Today, I've got an interview for you that is going to be all about genetics and osteoporosis. You might have heard that osteoporosis is 80% due to your genetics, which is a really, really big number. So today, I talked to Dr. Stuart Kim. He is a professor of genetics and developmental biology at Stanford University, and he started a company called AxGen. He's been working with his team to create the most comprehensive tool to look at the genetics around osteoporosis. And they now have a tool that they've brought to market that can help us to determine not only for people that have osteoporosis, how much is likely from their gene pool, but more importantly, we can take this tool and apply it to a younger audience. And then we can look and see who needs to be more concerned, who needs to be screened on a more regular basis, and at what age and at what interval. So this is a really important tool as we shift the conversation around osteoporosis from people that just have it, because that's important too. So it's not only people that have it, but also how do we prevent it and how do we change the focus on bone health from osteoporosis to using bone health as a biomarker of HealthSpan. So I think this is a really big piece of this. So enjoy this with Dr. Stuart Kim. All right, Dr. Stuart Kim, welcome to the Dr. Doug Show. Super happy to have you here.
Thank you, Doug. I'm pleased to be here.
Yeah, that was great. So this has been a while in coming. I met you in person several months ago at Johnny Harper's event in St. Louis and was totally captivated by what you're doing and all the things that are coming together for your company and with genetics and osteoporosis. So why don't we start by you just giving us a little bit of background into, your background and then what you built that got you here.
Okay. For most of my adult life, I was academic. I was a professor at Stanford. I was a geneticist. And what happened is that about 2018, there was discoveries in science that could be used. And I felt it was important to, just like you are, to build an outlet so these genetic discoveries could be used to help real people with diseases like osteoporosis. And we'll probably just discuss what the genetic discoveries were. Then I saw a real need to not just publish in academia, but to actually do something that could help people. And so I'm now on a crusade to try to alleviate the pains of osteoporosis to both improve treatment and prevent the disease with what I know about genetics.
Yeah, beautiful. Yeah, and so we were talking before we hit record, and you had mentioned that our missions are well aligned, and what you just said speaks so true to me because I recognize that my mission as well is to educate people that osteoporosis is absolutely preventable and oftentimes reversible, and that really this is the disease that if we do the right screening, the right testing, and the right early lifestyle intervention, this disease shouldn't exist except in rare circumstances.
Well,
Would you agree with that?
well, absolutely. That's the holy grail.
Yeah. So then let's talk about how genetics can be a part of that. So we know, doctors in the conventional medical system are taught, we don't have to screen until the age of 65 for women and 70 for men, except for in circumstances where someone is at risk of bone loss. One of those circumstances is a family history. And so genetics obviously is the piece of that we know is the hardwired part, but how much or how significant are genetics in this? And I get this question all the time, and I know you have a really interesting answer. So how significant is genetics when it comes to osteoporosis?
Right now, the literature seems to agree well that 80% of osteoporosis, let me be clear about this, 80% of your bone mineral density, which is the basis of osteoporosis, is caused by your genetics. So your exercise and what you eat and what treatments you get, that's concentrating on the 20% that is nurture, environment. 80% is due to what your mom and dad did. That's your DNA. And that you can't alter, but it's key to know how much that's improving, because if your genetics is bad, then you're fighting an uphill battle your whole life. And you were since the time you were born, And in your early adult, when you're in 20s, there is something you could do because your osteoblasts are really active and manipulable. Um, and you mentioned about DEXA testing. Right now, what's done is you wait till you're old before you start getting DEXA tests, and you wait until you add a fragility fracture, which is way too late. Whole idea, and we agree on this, is to get out in front of this. You know,
Yeah.
um, find somebody before they get a fragility fracture and stop that fragility fracture. And better yet,
Yeah.
find somebody when they're younger, before the bone density has decreased. So and I know that your bone density peaks at about age 30, and then it goes down as you get older. And a really good strategy would be to maximize the optimal, your max bone density when you're young, and coast down from a higher baseline so that
Right.
even when you're 70, 80, you're still above the threshold.
Yeah. Well, absolutely. I agree with that. And one of the things I say often is that we need to get screening tools in front of every young adult. So every 30-year-old man and female in the
Right.
world needs to be screened. But then the question is, whoa, how do you
How
do
do you do
that?
that?
Because there are not enough screening modalities, imaging
Right.
modalities, whether it be ultrasound or DEXA or CT or MRI. There are not enough in the world to do this at the scale that we need to do it. So this is where I think genetics could play a big role. So talk to us about how you see this coming into play in this, 30-year-old population.
Well, in my view, it goes like this. In 2001, the Human Genome Project appeared, and the promise was that we could all have a little file containing our DNA. So I have my DNA sequence, and because of that, I can look up any disease, genetic disease, and find out what I'm at risk for. So I'm not even personally at risk for low bone mineral density, but it's one of the things that could be tested with my DNA file. So the most efficient way to do this is to have everybody in the nation have this DNA file, and then just turn on the computers and spit out your risk for different diseases, including osteoporosis. And then the fraction, maybe 20% of the people in the country could know their risk of osteoporosis. And then it would make sense to do standard testing like DEXA or Echolite or something like that to figure out what
Yeah.
is your bone density. And the only problem is that DEXA testing, it costs a couple hundred, but it's not feasible to do DEXA test on everybody just in case they have osteoporosis or osteopenia.
Right.
Uh,
Yeah, and it also it's a very low dose of radiation, but radiation adds up. So we don't want to keep scanning people unnecessarily. That's why I like the idea of the ultrasound device. The REMS is
uh,
becoming more popular. But again, there is not enough literature out there for the medical community to support it in the US. And also there just are, there's 80 machines, I think, in the US right now, but there needs to be, 10x, 100x that if we're gonna screen everyone. So yeah, I love the idea that we can have potentially an additional tool. And so you mentioned this DNA file, and so I've done things like 23andMe. We do genetics in our practice in kind of a different way, looking at SNPs versus the whole genome. But talk to me about like if somebody has done something like 23andMe, let's say they have essentially their genome on file, right? You
right.
download it
Yeah.
and put it on a file. So what can they do with that? And maybe give us a little bit of background about the company AxGen and like what AxGen's actually doing and what they can do with that test.
AxGen is a DNA testing company. It's a lot like 23andMe. We're more sophisticated. Um, so instead of, and so we're focusing on, genetics of chronic diseases. And we use the most sophisticated test for osteoporosis. I think we're the only company that has this polygenic score. Our test for osteoporosis includes 22,000, almost 23,000 DNA markers. So different spots from all over your genome are contributing a small amount to how much uh, uh, to your bone density. Individually, that's tiny, but together, it's really quite strong. And we might get into some of that
Yeah.
later when you go. But that's all you need. 23andMe file is the same type of file that we would generate. And then so you can submit a 23andMe file and we can just analyze it. That's very cheap and very quick. Or we can send you a kit and you can start from scratch and you can basically spit in it too. When we analyze the DNA in that spit and give you your genome file that way.
Yeah, and that's so that I think it's a really powerful tool, but I know some questions that people are gonna have is, okay, what does this actually show me, right? Like what you say it's 80%, which is a big number of my risk comes from my genetics. So what does this actually show me?
This is data. So you and I both believe in data. This is why I
It,
think this genetic test could be used to improve and diagnose people with osteoporosis. So you start with your DNA file, your 23andMe genome or your AxGen genome. And we go through that DNA file and we look at each of these DNA markers, the 23,000 DNA markers. We say, do you have, and the DNA marker is one spot. You have one nucleotide from your mom and one nucleotide from your dad. So I might have a G on one strand from my mom and a T on the other strand from my dad. So I'm heterozygous G over T. Good. And then we ask at that DNA marker, which is the one that increases risk for osteoporosis. So imagine it's a T. And then we have the algorithm tells me how to add the information from the T. It's called a risk allele. And then we do that 23,000 times. We add up how many risk alleles you have. So between 0 and 43,000, 46,000 risk alleles. And after that, that's a score. Now, this score is appearing on the x-axis of this graph. So, and it's calibrated to be about like your t-score from a DEXA scan. So on this graph, it goes from minus 1.7 to plus 1. Okay, so that means that, some people were born to have bone mineral density at minus 1.7. And other people were born to have bone mineral density to be plus 1. These are guys that are not going to get osteoporosis. What's also shown is how many people have each of these scores. So that looks like a bell-shaped curve. Most people are in the middle, near 0. Few people are at minus 1.7, and some people are at plus 1.7, probably an equal number in each. Okay. Now the question is, how bad is it if you're at minus 1.7? What the graph shows is that it shows a red line, which shows your risk for getting osteoporosis. So at the middle of the bell-shaped curve, most people would just call that 0, which is no increased risk for osteoporosis. On the left of the bell-shaped curve, this red line just zooms straight up. And so on the left, if you're in this minus 1.7 point in the score, which is 2% of everybody has this DNA score. That's a 17-fold increased risk for getting osteoporosis compared to the middle. Now, having said that, the right-hand side is equally good news. So if you're on the right-hand side, you're born to have very dense bones. It's very unlikely that you're going to have osteoporosis. Almost everybody that does have osteoporosis has a DNA score on the left-hand side of this curve. And we know that because this curve was built from 400,000 people in the United Kingdom. And so we could look at 400,000 people who has osteoporosis, what was their DNA score? And virtually everybody that has osteoporosis has some sort of a genetic proclivity for low bone density. 17-fold is
Amazing.
a pretty big number. That's something that physicians would want to know when they're deriving treatment options. Um, so that's point one. Um, Point two is that DNA never changes, and so DEXA changes throughout your life. And if you rely on DEXA, you have to do a DEXA scan every so often for somebody. Uh, Through your lifetime, that might be many DEXA scans, and the cost will add up. This DNA test is once. If you ever got a DNA test, this will stay with you, and all that'll change is your your age will change, but your DNA score will not change. And because the
Yeah.
DNA doesn't change, it gives the opportunity to know your risk for osteoporosis when you're very young. And when you're very young, your bone density doesn't really, well, DEXA will work at all ages, but DNA score is equally effective at any age. So you can know at
Yeah.
20 what your trajectory is when you get to be pretty old.
Yeah. Well, what I love about it is that if you think about imaging younger adults, there's not as much data on a 30 to 40-year-old population as we have in other
All right.
populations, right? Because we tend to screen older individuals anyway. So we probably actually don't have all the data we need either, whether it be DEXA, quantitative CT, or ultrasound. We actually probably don't have all the data that we need. We can get it, but you're right, the genetics don't change. So this would be a great way to screen. And if people are falling on the left side of this graph, the people that are at risk for osteoporosis, then we could already, even without imaging, encourage them to do the lifestyle things that we know are going to be beneficial for bone and avoid the things that we know are not, if they're paying attention. So I definitely I see value in this, definitely in the younger population. But talk to me about your thoughts on how you see this working for, let's say, my population of patients. Because you and I have talked about, me plugging this into our program and getting this genetic test on everybody. How do you see that working in a population of individuals that already have osteoporosis?
Great. That's where you and I make a really good complementary team, Doug. So
Mhm.
you are working to derive, I think of it as a menu, treatment object, a treatment menu for what are you going to do with each of these different patients. And you can personalize that treatment, exercise, steroids, prescription medication, diet, all of those sorts of things. You're using your accumulated knowledge to figure out what to do and how hard to recommend that. And if you knew which of your patients had the bad genetics, you would know you're fighting something, and you could incorporate that into your treatment options. Versus if they
Yeah.
had low bone mineral, so if they had, really positive genetics, and yet they had low bone mineral density, I would think that what's going to happen is you do anything, change diet, change exercise, their bone density is just going to jump up because that was the reason why their bone density was low, was environment, diet, and exercise. But if they had, bad genetics, you could do diet and exercise. It might not have a big an effect. And
Yeah.
so you could say, okay, it'll change your expectations and would give you some advice as to how to treat each of these patients individually based on their DNA makeup.
Yeah, I definitely see, we've been doing this long enough, several hundred patients running through the program. There are cases where left shrugging our shoulders as to not understanding how we're not able to make
Yeah.
change, right? People would seem to be very good at the lifestyle change, and they're improving their diet and they're doing all the things, they're on hormones, and yet their bone just doesn't budge. And I think genetics is likely playing a role there, but because we don't have this data, we can't lean on that. I think it would be really great for especially that subset, that smaller group within our patients who aren't seeing the success that we would expect, if they had a very low score on this on this genetic test, then we know that we're just fighting a steeper uphill battle. And then also, there's two other areas where I think this could be really valuable. One is when people feel like, and I hear this all the time, especially in women, they feel like they've been doing something wrong, right? They have guilt, they have
Right.
anxiety, they have
Right.
fear. If we knew their genetics and say, look, you didn't do anything wrong, potentially, you've just got bad genetics for bone mass. So, let's stop blaming yourself for the things that you may or may not have done as an adult. You were destined to be here anyway based off of your DNA. So now let's take that and then let's decide what to do with it, which leads me to the third group. And the third group where I think this could be valuable is that most people come to me because they don't want to take pharmaceutical drugs, the bone health drugs. And I agree that they're overused and most people don't need them if they can do other things. But there is a subset of those people who do need them. And this could also help them to make that decision around using a drug or not. Because I think so many, especially older women, they feel like they're failing because they need a drug because they keep losing bone. And it might just be that there's too many factors, and genetics is definitely one of those, that we're not going to be able to overcome that with lifestyle at their point in time. So I could definitely see where there's a role for this in all three of those groups, and probably more.
Yeah, I agree. This thing about blame and, it was my fault that I have osteoporosis, a substantial problem. And we've had some of our customers with other bone health groups, they were just crying from joy from learning that they were born that way and that they can
Right.
take the guilt off the table. And if you have a score of minus 1.7, that's what you should expect to be. So if you have a genetic score at minus 1.7, you're at minus 1.7, and you're saying, I want to get above minus one, that's going to be a lift for you because you were born to be minus 1.7. And, you can use that sort of information to devise, what am I going to have to do to get from minus 1.7 to minus one? And what should I expect, should happen when I do all of these sorts of things? Well,
Yeah. Do you have a sense, because we're talking about bone mineral density,
right.
because I know you tested this with DEXA because we're looking at T-scores. Do you have a sense of what this means, what this score means as it relates to fracture risk and bone quality? Do we have enough data to be able to put any thought around that?
Yeah, we could, instead of looking at whether or not you get diagnosed with osteoporosis, we can look at, do you get a fragility fracture? The data's a little bit more noisy because fragility fracture is a little bit, it's not so absolute as a DEXA score. And I would have to look up at the data, but we can tell you what your increased risk for a fracture is.
Yeah. It'd be interesting to have some kind of a score, even if it's not particularly accurate,
Yeah.
but just getting a sense of, is it high, low, almost like some sort of gradation in between, like quartiles or something. And then bone quality, because we don't have a great way to measure it other than quantitative CT and maybe REMS as we learn more about what ultrasound looks like. I'm assuming we can't say much about bone quality based off
Not
of this.
yet. We would need data. And
Yeah.
this type of data, we would need 100,000 people to the
Yeah.
algorithms to start to work. So that will put that
Yeah.
into the future. That would typically
Well,
happen when everybody in the country gets a genetic score and starts to get the bone quality data.
yeah. So I'll put that in the back of my brain as I start talking to some of these bigger companies about these different research projects that need to be done, because that would be a really cool one.
Yeah.
REMS, fragility score, and this genetic test paired side by side with 100,000
Yeah.
people. That would be a really great study to do.
Yeah.
Yeah. And doable. Totally doable. All right. Well, Dr. Kim, if somebody's listening to this right now and wants to get this done, how do they do it?
They can come to AxGen and just either buy a kit or upload their DNA, and we can do it.
So in AxGen, that website we'll link to, obviously. And if they have a 23andMe if they have that 23andMe data already, then they can use a lower cost and just upload that file
Right.
directly to
Right.
AxGen and then get the score. So very easy to get, it seems like. So that's pretty exciting. What other topics did you want to talk about today with this? Because I mean, right now, I think everybody's probably just on their keyboard looking up AxGen and trying to get this test. Anything else you want to hit?
We could talk about the economics. Plan A is DEXA test everybody when they're 20 or 30, and then maybe do that once every couple of years, every 10 years or something like
Yeah.
that. DEXA
Yeah.
test, more or less, a DEXA test costs about the same as a DNA. DNA test is $200. DEXA test is $200, $300, $400, something like that. The thing about the
Yep.
DNA test is that one DNA test is you do it once in your life, and you do it once, it's every different disease. So you don't have to be looking for osteoporosis. You could be looking for type 2 diabetes and risk for Alzheimer's and risk for heart disease, all of those sorts of things. AxGen has 57 different diseases. And so that's where it gets economical. So you don't really know what you're looking for. You just test everything. And then the test
Right.
tells you, okay, like I'm not at risk for osteoporosis, but I am at risk for type 2 diabetes. That would have been incredibly useful for me before I got type 2 diabetes because I would have seen it coming. Same thing. Um, to me, one of the biggest opportunities in osteoporosis is that most people that have it don't know that they have it. So
Right.
once you know that there's osteoporosis, you've got some issues with your bone health, then you can go to optimal bone health. But what about for everybody that knows and goes to optimal bone health? There are 4 people that could go to bone health that don't know it, and that's what I think we could really change, and that's where we could prevent osteoporosis. Because I think, tell me if I'm wrong, um, you know, these fragility fractures, which is the bad thing about osteoporosis, occur with people that don't know. And if they don't know, there's no way you can treat them. You can't prepare them. You just have to react to it once they do have the hip fracture. But by then it might be too late. I mean, it's very serious injury. So really, how
Yeah.
do you get out in front of the hip fracture from ever occurring? And then you have to know these 80% of people that you're not seeing at all. And that's what I think
Right.
is really attractive about DNA testing is it lets you know how to do targeted diagnosis for all the different. So, to me, a lot of the chronic diseases have early warning signs. If you knew you're at risk for heart disease, atrial fibrillation, type 2 diabetes, osteoporosis, chronic kidney disease, all of these things, you could look with the gold standard diagnostic tools, but you got to know which diagnostic tool to order up. And then you can just get tested, be reasonable to do all of these. The diagnostic tool is cheap. Look at cholesterol levels and creatinine levels and bone densities.
Yeah, no, I agree. I think it's a really beneficial tool. And like I said early on, we've been using genetics from the beginning, just a different perspective. So we haven't had, the company that we've been using doesn't have this tool. So we haven't been able to utilize it. And we've kind of backed away from it for a lot of our patients because when you start looking at the entire, you start looking at all of the SNPs and all of the potential implications of the genome, it gets really overwhelming really quickly. So that's what I like about this specific test is because you're looking for, for growing osteoporosis, it's just one thing. Now you mentioned that AxGen tests for how many did you say? 37?
57.
57. So 57 tests. So if they get a report, is it going to tell them about all 57 things, or is it just telling them about osteoporosis?
It depends. For this, you need to have a physician in the loop. So I don't really want to tell anybody about serious diseases like diabetes. I'm not a physician. We're not a medical company. So we need to
Yeah.
partner with a physician group. So now the
Yeah.
advice, somebody that knows can give them good advice. Um,
Yeah.
so you would only get the ones that are um, health and performance, unless you have a physician in the loophole, which case you could get a lot more on different chronic diseases.
Interesting. All the reason for us to have it run through the practice.
Right.
Yeah. Yeah. Okay, great. Well, thank you so much for your time today. I'm glad we're able to bring this to our audience. Any last thoughts you want to pass along?
I can mention that we're working with groups like Optimal Bone Health, concierge bone health groups, and we've had very good success so far. I mean, we've been working for
Beautiful.
2 years and incorporating the AxGen test into the treatment plans as is giving some pretty good results. And our other partner is writing up a case study for publication, documenting how well this is working.
Beautiful. Oh, that's great. Well, again, we'll have more conversations about this offline, but look forward to at least bringing this information to the audience, and then we'll figure out how we can get this in front of, a few 100 million people across the world.
Great. That's
Okay,
the goal.
awesome. Thank you so much.
Thank you very much.
Talk to you
Nice
later.
talking to you.
Okay.
Bye-bye.
All right. Thanks for listening to this interview with Dr. Stuart Kim. I hope you found that helpful. One point of clarity, he kept calling our company Optimal Bone Health. I didn't correct him during the interview, but the company is called Optimal Human Health. So if you're looking up online, it's Optimal Human Health. MD actually is the company, optimalhumanhealth.com. But we'll have all of the links for AxGen and Dr. Kim in the either in the show notes or in the description on YouTube, so you guys can check this out. The cost of the test is relatively low. He didn't actually say it. I want to say it's between $200 and $300 for the cost of the test. If they're doing the genetics, it's even less than that if they're not. So I think this is a potentially really powerful tool depending on where you are. Is it prevention? Is it treatment? Are you frustrated by the fact that you're not seeing improvement? You want to know if this is a factor in that. So I think there's definitely a role for how to use this clinically moving forward and also in prevention for sure. So use it if you want. Drop us some comments and questions if you would like. And if you need more support, you can consider one of two things. Either our masterclass, which is a totally free hour of my time that I spend every other week with hundreds, potentially sometimes thousands of people across the globe who come here. We talk about the 5 common mistakes that we see with osteoporosis. So the masterclass link is in the description on YouTube. Or if you just want support community, consider coming to our Osteo Collective community. There's a 7-day free trial. You can look for that link in the description as well. I'll see you in the next video.